Year after year, literally millions of people endure the misery and agony of living with chronic pain as their hopes of ever getting better slowly diminish with each failing procedure. Up until now, most people living with pain thought that their options for treating their condition were limited to taking potentially harmful, habit-forming drugs that do little to actually solve the problem, undergoing usually quite painful injections or procedures that try to numb or deaden the nerve, going through invasive, often radical surgery that requires weeks or months of recovery time with no guarantee of success, or, tragically, just resigning themselves to living with the pain forever. Until now, nearly a decade of experience has led Dr. Ben Jakob to the development of treatment protocols that have changed the lives of hundreds of chronic pain sufferers for the better. This is not a one-size-fits-all solution, but rather the unique combination of various new, innovative, and distinct methods to produce results that otherwise would not likely be possible. Each patient is closely evaluated by Dr. Jakob, and a custom-made treatment plan is formulated to attain maximum results. The combined methods may include manual spinal decompression, computerized spinal decompression, low-level laser, ambulatory traction, various cutting-edge soft tissue techniques, proprietary taping methods, and much more. Stay tuned for the rest of this fascinating documentary to learn how you can get back to the life you used to have and deserve to get back.
Hi, I'm George Mitchell, former special agent, ex-police officer, serving U.S. military. About 10 years ago, I had lower back pain in my legs, and I couldn't walk or sit or even sleep properly.
Life was miserable. The pain that I had going down my back, Doc, was like a hot sword sticking down my left leg from my back to almost to my ankle. I could not get myself dressed. I could not tie a pair of shoes. I could not put socks on. I could not get out of bed. I could not do simple chores around my home, like cutting the lawn, picking up the twigs that branches drop off, taking the trash out for my wife, washing dishes. I could not do these things. And I could not shoot pool, and I do enjoy shooting pool.
I was in tremendous back pain and discomfort, was not able to even work due to the weight of my gun belt. Most normal activities caused excruciating pain.
I was in misery, I had pain, I had a hard time working, and I could not sleep. And that was probably the biggest problem.
I had a herniated disc that was pressing on the nerve. It was giving me a tingling sensation down my right leg, burning in my right buttocks.
I was in so much pain. It finally hurt to stand, walk. I couldn't even move without being in intense pain.
What I'm finding with many patients who are dealing with pain on a consistent basis is that they simply don't know all of the valuable options available to them on a non-surgical level. After 10 years of practice, I'm constantly being told by satisfied patients that they wished they would have known that all of the options were available to them prior to having been treated with modalities that simply don't help their cause.
My doctor had me on Percocets, I believe they were, painkillers. Told me I needed to go to surgery. I couldn't take the painkillers no more because I was living on painkillers to the point where I thought I was getting addicted to them. I couldn't do anything without my wife's help.
He was on pain medicine all of the time, and he was out of work for nearly a year, and that was a very difficult time for us. That was very hard to go through that.
I was unable to get relief through normal physical therapy treatments, which I had been in approximately 3 months prior to coming to Dr. Jakob.
I talked to 2 surgeons about the pain, and they suggested that I have a a fusion of my lower back, and that scared me out of my wits, and I decided not to have that type of surgery.
Why resign to living with pain, taking drugs endlessly, or having surgery when so many wonderful treatment options are so readily available?
Spinal decompression therapy involves a mild traction force which aims to reduce the pressure within the discs of the spine so that more space can be provided for vital structures. During the treatment, fluids are rushed back into the ruptured or degenerated discs, allowing the healing process to take place. The procedure is usually painless, can be done fully dressed, and is usually very effective in the treatment of acute or chronic spinal pain. Patients usually experience some relief of pain within 2 weeks of care. For even better results, Dr. Jakob combines both manual and computerized forms of spinal decompression therapy during each visit. This proves to be a 1-2 punch against pain, which seems to provide faster, more potent results.
I thought he was going to be disabled for the rest of his life at the age of, at that time, 47 years old, or 48.
I thought I was wheelchair bound.
Yes. When we came to see you and when he had almost immediate relief from the first table that you put him on, I can't even begin to tell you what it was like for me. I mean, I could just get emotional right now because that was such a hard time for us. What I felt when he was like, oh my goodness, this feels so much better. And it was like, this sigh, and the weight was taken off my shoulders. And then as he continued to go back and to come back to you, and he got better and better, it was like the light was getting brighter and brighter.
Dr. Sadovnik, you've told us a lot about the many patients that you have referred to me for treatment of pain. But you have a personal story regarding your pain and treatment in our office. Can you tell our viewers about that?
One day I did a really bad movement with my neck, and I had the most incredible pain I ever had in my life. Being a physician and treating pain in patients, believe me, it was not easy to treat myself. I asked a physician to help me, but after several weeks of dealing with this severe pain, I got an MRI and ended up having a herniated disc in my cervical spine. Waited a week later, the pain, despite about strong medications, was getting worse. So I called you. You took me in your office. I remember 5 treatments were enough to take care of all the pain, but after the first treatment, I was 80% improved. Thank you very much for all you did for me. Not only that, then my wife had a problem with her own spine, and I also sent you my daughter-in-law. They both doing really well.
Can you tell our viewers what the treatments felt like? Were they painful? Were they uncomfortable? What were they like?
They were totally pain-free. They were so comfortable that I almost fell asleep most of the time on the tables that I was being worked on. I was that relaxed, and I'm not a type of person that relaxes very easy under these circumstances.
Mike just kept saying, wow, this feels really good. He was getting relief immediately.
Treatment was amazing. I'm a whole lot better, almost 98% better, Doc. I can shoot pool, I can go back to work, I can wash dishes, I can take a bath. I cannot believe how relieved I am.
No pain medicine.
No pain medicine whatsoever.
I have my husband back. That we were facing maybe a permanent disability. And we heard that several times.
Yes.
And I just said, this is not happening to us. We're too young. He's too young. This is, maybe that happens when you're 75 or something. Yeah, I have my husband back. I have my life back.
With so many new cutting-edge devices, instruments, and treatment protocols entering the market over the past few years, we have numerous amazing treatment options for patients to try. The beauty of my practice is how we can effectively treat almost any body part, from knee injuries and arthritis to headaches, shoulder and elbow problems, hip pain and dysfunction, ankle pain and plantar fasciitis, carpal tunnel syndrome, tendinitis, and chronic pain syndromes. We use cutting-edge tools like low-level lasers to reduce inflammation and pain, proprietary taping methods like kinesiotaping to improve range of motion and increase circulation. We use stainless steel tools, or my hands, to break up adhesions and loosen tight muscles, or a remarkable device called the ATM2, which immediately reduces pain and increases functionality. Bottom line, no matter where you're experiencing aches and pains, odds are I can help you. And the best part of all is that most of our treatments involve little or no discomfort.
Dr. Jacob's impressive treatment results and hundreds of success stories have not gone unnoticed by the medical community. Many doctors within the greater Baltimore area are referring their patients to be treated by and cared for by Dr. Jakob and to experience the benefits of his unique methods of treating chronic pain. Listen to what the Chief of Neurosurgery at both Sinai and St. Joseph's Hospital, Dr. Neil Naff, has to say. Spinal decompression therapy is usually an excellent option for patients with tough-to-treat spinal pain. I send my patients directly under the care of Dr. Ben Jakob because he is able to correctly determine the appropriate course of action for each individual patient and therefore deliver the best results. His unusually high success rate and stellar reputation speak for themselves.
I really appreciate Dr. Jacobs. I really think he's a godsend with his technique.
And I'm here to tell you today that I have no pain. I'm about to turn 60 years old and I feel great. I want to say again, thank you, Dr. Jacobs, for all the help you did for me.
I went for my follow-up visit to my physician's office and told him my results. He was amazed. He couldn't believe I had absolutely no pain. I would recommend Dr. Jacobs and his decompression therapy to anyone. It's amazing. It helped me.
If you have back pain, as I've experienced on and off for approximately the last 20 years of my life, I would definitely recommend that you seek the assistance of Dr. Jakob because it works. It truly works.
Thank you for helping all of our patients. And for all the viewers that are watching, you have any pain right now, or you know anybody who has pain, acute or chronic, do yourself a favor, call Dr. Jakob. He will help you the same way he helped me, my wife, my daughter-in-law, and more than 100 of my patients.
If you're one of the patients who is still struggling of lower back pain and so far all the different modalities didn't help you, I would highly recommend to call Dr. Ben Jakob, ask him for evaluation and treatment, and I would feel very comfortable to advise my own patients to do the same thing.
My suggestion to anyone that has pain in their back, neck, legs, and they've had other types of treatment and it has not been alleviated, give Dr. Jacobs a call and see what he can do for you. He certainly did wonders for me, and that's from the heart.
I don't care how long you've been in pain. I don't care how many treatments you've tried and tested. You owe it to yourself to give me a call and allow me the opportunity to help you resolve your pain issues once and for all.
In this fast-paced world where every minute matters, you can't afford to be slowed down with pain. The opportunity to improve your situation has never been easier. Experience for yourself what hundreds are calling the most effective form of treatment they have ever tried. Even if you have not gotten better with physical therapy, pain medications, exercises, injections, or even surgery, the perfect solution for your pain may now be available. Imagine how great it would feel if you could finally get back to feeling like yourself again, being active and energetic with your friends. Why not start now and make up for all the time lost that you've missed with loved ones because of your nagging, horrible pain? Whether you're a tireless weekend warrior who's been stopped in your tracks due to pain, or are simply trying to enjoy your golden years gracefully and comfortably, you owe it to yourself to give Dr. Jakob a call and see how he can help you. Call now.